Hello everyone. Today we go on our discussion about G theory. So imagine a nurse entering a break room after a long shift, taking out her lunchbox and begin to eat. Why does she choose her own lunchbox rather than someone else's? This is because every choice we make is the result of a G vector effect, where one G wave dominates over others. In this case, the nurse's memory G about preparing her lunch and the moral G guiding her ethical behavior are both active. Their G waves influence her decision making process. Now, imagine if the same scenario involved a ravenous wild person disguised as a nurse without the influence of these two Jews. They might simply grab whatever food they find and devour it. So let's go on discuss the influence of inhibitory and activating G waves. Why do people tend to make impulsive decisions like infi- infidelity, infidelity after drinking alcohol? Alcohol can inhibit or weaken moral and self-control G by blocking their pathways, reducing the strength of their G waves. As a result, other Gs, such as those related to sexual desires, can dominate in the G vector effect. Similarly, a normal reserved man might succumb to the advances of an attractive, persuasive woman because the G waves from sexual urges accumulate and overpower the moral G waves. Let's return to the nurse. She starts eating her lunch, but why does she stop when she's full? This is because another set of instinctive G's related to um, satiety become active as she eats. These G's generate G waves that suppress her desire to continue eating. For some, though, the situation is different. Why do some people stop eating when they are only 70% full? Even when the food tastes amazing, they might only take a few bites. This behavior could be driven by other active G waves, such as those associated with dieting, health consciousness, or even altruistic thoughts, thoughts like saving more for the kids. At any given moment, the dominant G waves determine behavior. These waves can strengthen suddenly due to environmental factors or remain consistently strong over time. When a behavior repeats frequently without clear environmental triggers, it often indicates a powerful internal cue. For example, imagine a woman sitting by the roadside, constantly muttering to herself. This repetitive behavior suggests a strong G at work. Some might quite quickly label her as mentally ill. However, using the G framework, we can understand that repetitive behaviors, whether it's a muttering woman, a scientist deeply engrossed in research, a stock trader obsessively checking the markets, or a housewife who loves shopping all reflect the dominance of specific Jews. To determine what someone has a psychological disorder, we must study their behavior closely. Through investigation, we can identify which Jew is influencing the behavior, how it's being activated, and whether it's abnormal. It, if treatment is needed, the Jew framework provides various intervention strategies, creating new Jews to influence the Jew vector, reshaping existing Jews through behavior or cognition, or even using advanced medical technologies to modify the structural or electromagnetic properties of the Jew. So let's talk about how do Jews become stronger or weaker. The strength of a Jew often depends on repeated activation. Take the scene. Practice makes perfect. The idea aligns with the strengthening of Jews through repetition. Re- Examples include Pavlov's conditioned reflexes, the active cycle of gambling, or the development of phobias from a single traumatic event. Conversely, Jews can weaken when stimulation is absent. Consider Pavlov's extinction of reflexes, gamblers who quit after losing everything, or or the effectiveness of cognitive therapy for depression or desensitization therapy for phobias. The strengthening or weakening of Jews is fundamentally about reshaping them. Repeated inputs of characteristic G waves enhance G stability, while a lack of input weakens it. These G waves could come from external stimuli, while sensory organs or internal brain generated simulations. Positive or negative feedback from G waves can attractive instinctive G related to attraction or avoidance, leading to behaviors like eating, gambling, shutting oneself in, or escaping perceived danger. These behaviors, in turn, reshape the original Gs, often reinforcing them when the behavior proves effective. In the context of treatment, interrupting the feedback loop or altering the input of G waves can significantly reshape a G. For example, positive reinforcement for new behaviors or the absence of feedback for unwanted behaviors can weaken the original G. This approach has proven valuable in treating mental health disorders, emphasizing the profound impact of reshaping G waves. Understanding G waves offers a profound framework for comprehending human behavior. Every action, whether impulsive, habitual, or deliberate, is a reflection of the dynamic uh, interplay between activating and inhibiting G waves. With further research and innovation, this understanding could pave the way for revolutionary approaches to behavior modification, mental health treatments, and even personal development. Let's continue exploring the limitless potential of our Gs and their intricate waves. So that's all. See you next time. Bye bye.